Your doctor has recommended you undergo a transurethral resection of the prostate, or TURP. But what does that actually mean? The prostate gland is a walnut-sized organ which is part of your reproductive system. It provides some of the fluids contained in semen. The prostate is located just under the bladder and behind the testicles. The urethra, the hollow tube that carries both urine and semen to the penis, passes through the prostate. In some men, the prostate gland becomes enlarged. Symptoms of an enlarged prostate include a full bladder feeling even when the bladder is empty, pain when urinating, weak urinary stream, infertility, and sexual dysfunction. To relieve you and your symptoms, your doctor feels that you would benefit from a surgical procedure called TURP. TURP is designed to relieve symptoms by reducing the size of the prostate. It is also a diagnostic procedure. Tissue removed during a resection of the prostate, or TURP, is routinely screened for the presence of cancer. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to the operating table. Once on the table, your feet and legs will be placed in an elevated position with your knees apart. And the nurse will swab the penis with an antiseptic solution. Your doctor will then lift your penis upward. A well-lubricated instrument called a resectoscope is then gently inserted into the urethra. When the resectoscope reaches the back of the penis, your doctor will pull the penis downward in order to create a straight path into the prostate. Once the instrument is inside the prostate, your doctor will extend a small loop of sharp-edged wire from the end of the resectoscope. Using this tool, your doctor will then scrape excess tissue from the prostate, restoring it to its normal size. Tissue removed from the prostate may be sent to a laboratory for analysis. When the surgery is complete, your doctor will remove the resectoscope. Your doctor will probably ask you to wear a temporary Foley catheter. A Foley catheter is a narrow tube inserted through your urethra and into your bladder. The catheter is connected to a bag that is attached to your leg by a strap. While the Foley catheter is in place, urine will pass from your bladder into the bag. You will not need to urinate into a toilet. The nurse will show you how to change the bag when it's full. An appointment will be made for you to return to the doctor's office in a couple of days to have the catheter removed. As soon as the anesthesia wears off and you feel comfortable, you will be allowed to leave.